Now, earlier we looked at CPR, cardiopulmonary resuscitation, when somebody actually has sudden cardiac arrest. This is when the heart completely stops. We spoke about 10% drop in survival rates with somebody who's having CPR done on them. Now, surely it's much better to try and recognise this person is having a problem before the heart stops. Maybe if we can recognise it a few minutes, or maybe 10 or 20 minutes beforehand, when they actually get to the stage where the heart may stop, paramedics will be there. They may have already started administering drugs to them, may already have them on the gauges and be able to tell exactly what's happening. So what we really need to do to start with is to recognise somebody's having a heart attack. Now, some things can look like heart attacks, very bad indigestion for a start. Other trials have been done with, particularly with men, if they're having a heart attack, denial. They don't accept it. Maybe they think they're beyond having a heart attack. Maybe they're only in their low 40s and they're trying to think they're healthy. So what they blame it on other things. They'll blame it on the food, they'll blame it on indigestion. Your job as a first aider is to try and recognise this and maybe just see a little bit through it. Indigestion can be painful. People get upset, but you can look at the colour of the skin. Maybe it starts getting a bluey colour, or maybe they're sweating. So recognition is the most important thing. Another type of heart condition can be angina. Equally serious, but this can sometimes be controlled by just giving them their medication. So maybe they will ask you to go and get their medication, or they'll take their medication as a tablet or maybe as a mouth spray. And this will usually, in most cases, in 5-10 minutes, then they'll start feeling better. If it doesn't work within that space of time, what we need to do is we need to treat them as if they're having a heart attack and activate the emergency services. If you've got somebody who's feeling unwell and maybe they're restless, the important thing to do, if you bring them around, go down, is just sit them down into a position of comfort. Just lean yourself forward. Just calm and reassure them. And you don't really want to put them any stress. You don't want to lay them down where they're lifting their legs up, because it's putting more strain on the heart. We want to try and keep them in a position that they feel comfortable at. Important thing is this person is very worried, very scared. We need to reduce his anxiety levels, keep him calm. If the heart was to stop, we can then lower him onto the floor and carry on with CPR. But in this position, he's happy, he's relaxed, and we can activate the emergency services and get help to him as quick as possible.